Hey everyone! I am excited to introduce Crom Carmichael today, a investor in 60 plus startups, the producer of the Giants of Political Thought audio program, and he has his own podcast from our generation that he just had another episode today with some overlap around the government shutdown issue. I'm excited to chat about that and much more. Crom, how are you, sir?
Fine, Evan. How are you?
I'm well. I am
Good.
well. I am well. Tell me about what's going on here. We were just chatting beforehand, and we are talking about this interesting overlap between your podcast and the government shutdown that you were talking about today. Why don't we chat about that a little bit?
Happy to do so, Evan. Just kind of to give your audience a bit of a frame of reference. I'm 77 years old, and so I've spent a lot of time during my life, kind of observing things, thinking about things, and trying to come up with some ideas and principles that help guide me in my thinking. And there are three ways that people learn. One way is they learn from personal experiences. Another is they learn from observations of things going on around them or in real time. And then the other is they learn from history. And so for me, my political thinking goes all the way back into the 70s from personal experience, because the first election that I voted in was 1972. And that was when I voted. I voted against George McGovern because I didn't think he would be a very good president. And so when I look at the evolution of politics, I look at the economy and how it's evolved in the last 50 years. It's quite extraordinary. And there was a Nobel Prize that was awarded in economics just a few days ago, and to me they were awarded the Nobel Prize for proving the obvious. And that sounds kind of strange, but what they said was, they said innovation is a requirement for increasing prosperity, and you must have consistent innovation if you're going to have a consistent increase in the rise of prosperity. And then they went on to say that innovation can only take place in a practical way if the society that you live in protects intellectual property. Because they said historically, they pointed out that Leonardo da Vinci invented the helicopter back in the 1500s, but there wasn't the material to make it. But the helicopters that fly today was actually Leonardo da Vinci kind of penciled it out, and it was it's amazing.
Yeah, if only he had the ability to create that intellectual property.
Yeah, well, if he had the ability to create it, then you had materials, you have engineers, you have many things. But it's just an interesting thing that ideas can be so old, but
Yeah.
not go anywhere. And so at any rate, so the Nobel Prize says you have to have intellectual property, you have to have free markets, and you have to have and innovation. They went on to say innovation is inherently destructive of old ways that are less efficient, and that's a key point here. That innovation is inherently destructive of old, less efficient ways of doing things, and that is the nature of progress. So, having said that, here we have a government shutdown, and the government shutdown. The argument is that the Democrats do not want to allow the government to operate on a continuing resolution unless Republicans will agree to essentially $1.5 trillion of additional spending on health care that would include illegal immigrants. Now, the question of illegal immigrants is a separate question to me than the economic question. And the economic question is, do we want to spend more money on a healthcare system that where we already spend an average of $15,000 per person? That's $60,000 per family of four. And so when you say that, and you ask the typical family of two or three or four, five people, you say, how much money do you spend on healthcare a year? And the typical answer will be, oh, maybe $1,000 or $2,000. And so then the question is, well, where does the 60,000 go? And the answer is 2/3 of our healthcare system is paying for the payment system. It's paying for insurance. It's paying for the insurance companies negotiating the prices and then managing every single expenditure in the healthcare system before reimbursing the provider. And so what you have is a system that is unnatural, and it is inherently inefficient. And so if you continue to spend, if you put more money into it and more money into it, all you do is you increase the resistance to change, because then the beneficiaries of the inefficiency form their own special interest group. And so that's where you are. That's where we are today. And
So,
healthcare reform
so
is probably the greatest area to improve our economy. But here's what's interesting. Most people will argue, well, our healthcare system, while it may be funded by the government, it's a quote free market system. They'll say it's privately owned, and it's true that most of the providers are privately owned. That is true, but to argue that it's a free market system is incorrect, because for there to be free markets, there has to be price transparency, and there has to be competition. And once you sign up to a particular plan, all the competition goes away, and you never know the price of healthcare before you consume the healthcare. And then you're not even part of the bargain. Your insurance company or the government. I just have my granddaughter walking. I'm a little busy. Could you? Thank you. That was my 3-year-old granddaughter. I have a new
hello.
baby. A new baby came last night named Reynolds.
Oh,
And so we are babysitting my 2 granddaughters while their mother is.
congratulations.
Yeah, thank you very much. I appreciate it. Sorry
That's
for the interruption.
wonderful. You must be so excited. No, hey, that's a natural, exciting interruption. Well, look, let me sort of
Sure, push back on that.
a couple. Yeah. Well, I don't know if I'll push back, but I'll ask a few questions that may get us somewhere in the solutions part of this, potentially. Part of any system when you give money to is, are you actually just providing more water in a leaky pool? Right. I don't know. Any system can be argued that the more you put into it, if there's a leak, it's just going to drain out, and depending on how big that leak is, right?
Sure.
So
Yep.
I mean, every NGO has some administrative cost. For example, the government is, you could say, it's causing anything it focuses on in general, any cause it focuses on, homelessness, whatever. Well, how much goes to administration? Right? There's some processing fee involved in everything. And I guess the question is, when it comes to healthcare, because you can't do it without a processing fee entirely, um, what is the acceptable amount of processing, administrative cost, overhead? And it could change based on the industry. It could change based on the system, based on the standards of what can be done right now without innovation, right? Of what the private industry is doing versus the public sector. Often they're much more efficient. What do you think in healthcare is an acceptable amount of, like, this is wasteful spending
Okay.
on yeah.
Yeah. Let's. And that is the central question. So I'm going to answer it this way by talking about a couple of other industries and how we take care of lower income people, and then another industry having to do with insurance. Uh,
Right.
Almost everybody owns a car. People who own a car have car insurance, but the car insurance is used only if there is an extraordinary event called a car wreck. There is no insurance for buying gasoline. There's no insurance for tires. There's no insurance for if you need brakes or a transmission. In fact, there's no insurance that helps you even buy your car. And so those are expenses that range anywhere from $60 or $70 to fill up your car, to a couple $100 a tire, to $3,500 if your transmission breaks. And these are all things that the average the average person who owns a car has to figure out and can figure out a way to pay for those things. But if they have an accident with their car, that becomes the only time that insurance is involved. So if we were to take that and say, let's apply that same principle to healthcare, then what you would say is you need healthcare, you need health insurance for the truly expensive, extraordinary events, which is called hospitalization. I'll tell you a story. In fact, I can tell you two very quick ones. One is when I was about 52 years old, which is 25 years ago, I had my first, when you hit 50, your doctor will tell you you need to have a colonoscopy. And so I had my first colonoscopy when I was 52. And at that
I'm looking forward
time,
to those. I'm looking forward to those, by the way.
oh, they're a blast. Yeah, they are fun, especially
Tell
especially
me,
the
I
day
can't wait.
especially the day before when you have to drink all that stuff that clears you out. So anyway, too much information. But at any rate, the doctor who was going to perform the colonoscopy, I spoke with him, and I said I don't have insurance that covers this because it was below my deductible. At least I thought it was. And I said, "Do you have a cash price?" And he said, "Well, if you don't have insurance and you're going to pay me ahead of time or at the day of service," he said, "and I'll handle all of it. I'll charge you $1,200." And so I had a colonoscopy that included the anesthesiologist, the facility, and the doctor. And then 7 years later, I had my next colonoscopy, same doctor, same procedure, $1,200. I had the same colonoscopy with the same doctor 7 years later when I was 64. And or maybe it was 5 years later, but I was 64 just before I was going to hit Medicare. And once again, it was $1,200. Now, that particular colonoscopy, and this is why this story is so important, that particular colonoscopy took place in October of whatever year it was. I have a son who was in college, and he had an uncle who had died of colon cancer. And so colon cancer was a concern. He mentioned to me upon as he was coming home for Christmas vacation, and he exercises. He's a fanatic, and he mentions to me. He says, Dad, I had a strange thing. I had some. I had to take a poop, and I had some blood in my poop. And I go, really? And he says, yeah. So I call my doctor, and I said, look, here's his uncle's situation. Here's what happened to him. I know my son's only 20 years old, but should he have a colonoscopy, given his family history, should he have a colonoscopy in order to mitigate that risk? And he said, given the family history, the answer is yes. So, because he had a college insurance plan, we ran that colonoscopy through insurance. Now, I had just had a colonoscopy 2 months earlier, $1,200. His colonoscopy came back. You know what the EOB is, the explanation of
Hmm.
benefits
Hmm.
that you get, which says this is not a bill. It
Hmm.
says that colonoscopy cost $11,000, and it would be negotiated down to $6,600. So the providers got $6,600 for doing something that they did for me 2 months earlier for $1,200. And I'm telling you that is not unusual. Give you another circumstance. I've had recently, I've had 3 very small melanomas found on my skin. One over here, and then one right here. And the dermatologist said, "Well, I'm going to have to schedule you to be with a doctor who will cut those out." He would only do one at a time. And I asked him, I said, "Why are you doing this one at a time? There are 3 of them. Why can't you do it all in one visit?" He said, "Well, I only get paid for each visit." So he got paid 3 times to do what he could have done one time.
Yeah.
But he got 3 times because that's what the system is. And so you don't have a free market when you have a government or insurance companies controlling the relationship between the patient and the doctor, and also then sets the pricing. So my solution is to have widespread HSAs, health savings accounts. I hope you have a health savings account because they're, from a tax standpoint, they're fabulous.
Hmm.
And so for to have widespread HSAs and then have require price transparency for all providers up to hospitalization. I will acknowledge that hospitalization might be too complicated to have price transparency initially in hospitalization. But everything else that we do, any kind of outpatient surgery, if you have a knee replacement, if you have a hip replacement, anything that's outpatient, you ought to be able to get a quote ahead of time to pay in full out of your HSA. And
Yeah, interesting.
that would reduce the total price 70%, Evan, 70%.
Wow. Well, even if you don't have an HSA, it would be transparent to say, look, just pay, if you were to pay this as is, like this is the cost of, and for basic things that you have to do once a year that most people, spend, would get a blood test, right?
Sure.
Or whatever,
Your annual physical. Your annual physical.
you're at, okay. So you do that. Let's just call that all $500 or $600 a year, not $6,000 a year or something, right? So,
Right.
and even if you were to pay the administrative fee to even manage something that can handle just that, it shouldn't be 10 times the amount.
No, but here's what's interesting. What is the administrative? There is an administrative fee that you can identify when you buy gasoline by using your credit card or debit card and sticking it in the pump in order to pump your gas. And that administrative fee is the 3% that that the credit card company takes to move $70 from your account to the gas station's account. That's the administrative fee.
Mhm.
And it's over and done all at one time.
Yeah,
Healthcare doesn't have a 3% administrative
yeah,
fee. It has a
yeah,
60% administrative
yeah.
fee.
Right. But you also have to, I guess you also have to include the ability for someone to make money on it, right? So let's just say a doctor provides a service. Let's say he wants to make twice as much as what it cost him for that 30 minutes. And if he divides all of his expenses into a 30-minute interval of the office and the whatever, right? So you've got that 30 minutes, call it $100. I
Yeah,
don't know,
but
for a
part
person
of,
to manage it, the facilities, the electricity, right? So if we assume that he has to make money or
sure,
she has to make money.
sure,
Yeah.
just like the gas station has to make money, but the administrative
Right.
fee is
Exactly.
still 2 or 3%. Now, a doctor,
Yeah. Right.
unfortunately, now you talk to doctors today, and I'm not talking about doctors who are in hospitals. I'm talking about all the other doctors, the ones who are in offices or do their surgeries in outpatient facilities. You ask them how much time they spend having to argue with insurance companies, and it's a big part of their day that they're
Yeah.
having to provide documentation to get paid by the insurance company. Well,
Yeah.
but when you decide to buy a set of tires for your car, there's no administrator who's helping you negotiate the price of the tires. You look at your
Yeah.
different choices and you make the choice yourself. And it might be the very best choice, or it might be not quite the best, but you can't be that far off. Otherwise, the tire provider would go out of business.
Sure. Everyone's got to make money and everyone's
Sure.
trying to get in the middle of transactions. A lot of times businesses seek to get in the middle of the transactions to provide value on both sides and get paid by everyone
Yeah.
all the time. Right.
So
And that's part of the,
let's talk a little bit about how the system got to where it is, because that's really important. At the
yep.
end of World War II, Roosevelt had put on wage and price controls. And at the end of the war, businesses were making a lot of money. And business people went to Roosevelt and said, Mr. President, we're making a lot of money. If you want to keep price controls on, that's okay. But we'd like for you to take off the wage control so we can pay our employees more money. And Roosevelt said, no, wage controls will remain, but you can pay for their health care. And that was the beginning of the third party payment system. And
Mm,
so, and Roosevelt said, and I will let you, Mr. Business Person, I will let you deduct the cost of providing health insurance to your employees. But if your employees spend their own money, they can't deduct it. And so it was a natural thing, given the tax policy It was a natural thing
Mhm.
for employees to want their employers to pay for their health insurance. And the employers would say, well, I can deduct it, and Roosevelt won't let me raise their wages anyway. So I will start providing health care. That gave rise to insurance companies. Then in the 50s, private sector unions, and in the 50s, private sector unions were very, very powerful. They then negotiated into their contracts health insurance paid for by their employer, and it was first dollar coverage. And this is a key point. So first dollar coverage means that insurance companies have to be involved in every single transaction, no matter how inexpensive it would otherwise be. So that's where single, just 10-minute doctor visits became
Right.
covered by insurance. And then all of those had to then be priced, and then
Yeah.
then the adjudication process and all these different things to make sure that doctors aren't, quote, defrauding the system. So you have all these checks and balances and expensive um, uh, programs put into place in order to mitigate people who would cheat. And since the patient wasn't paying the bill, the patient didn't care what the price was because they couldn't do anything about it anyway. And so
Mhm.
then we get into the 60s, and then Medicare was passed, and then Medicaid was passed. And so now the older people, which represented at that time about 7 or 8% of the population, they all of a sudden now are covered by a third party payment system, and the bottom 20% on Medicaid were covered by a third party payment system. And those and Medicare, by the way, when Medicare was passed, the people who supported and promoted Medicare said in 1968 that in 20 years the cost of Medicare to the federal government would be $8 billion, and in 1988 it was $80 billion, 10 times more than they projected. So then Obama, when he gets to be president, there's a lot of people who are kind of in between insurance and one thing or another, and so he devised Obamacare. And he made a couple of promises that are famous. If you want to keep your doctor, you can. If you want to keep your insurance, you can. Those things turned out not to be entirely accurate. But the biggest thing he said that wasn't true was he said, if we pass Obamacare, it will reduce the cost of health insurance, $2,500 a year for the average family. And in fact, by the time Biden became president, it had gone up $10,000 a year for the average
Mm.
family. And so
Yeah.
and so that's now where the angst and where the political questions are. So I'm an advocate not of the shutdown or not the shutdown, but I am an advocate of recognizing that the most inefficient industry we have in our country in terms of the amount of money we spend that's completely wasted is healthcare, and that there are ways to fix it. Now, the insurance companies would fight me like a tiger. The pharmaceutical companies would fight me like a tiger, because if a third party is going to pay for it, then I'm going to negotiate and ask for a much higher price because I don't have to answer to the consumer. And so what do you think about what we're talking about here?
Well, I think, yeah, I think the one of the questions I had earlier was what is acceptable, right?
Well, to
So
me,
if we were to yeah, what is an acceptable? So if we were to say you would normally on your own pay, $1,000 or $1,200 for colonoscopy. What what should it be for, and for what service? Right? Should it be $1,200 or should it be 2,000? What should they charge? Um, Instead of 6,600, which was mentioned, that was negotiated down to, right? Like what? Or do we just get rid of the system and use the system that you've kind of identified here with an HSA
I,
account?
if you have competition, and competition requires price transparency so that the consumer can look and pick and choose. Now, then the consumer still has to have the ability to pay, which is why I'm advocating HSA accounts. I would
Right.
give now. Let me use one other industry. The most when if I ask people what's more important, if you have to have one or the other, what is more important, having food or having health care? And they say, well, what do you mean? I said, well, if you have to choose having no food or no health care, which would you choose? And I said, well, heck, if it's that, I'd choose no health care because I have to have food to live. And I go, okay, well, then food is a greater necessity than health care. But we don't have food insurance for the average person. We have food stamps for the
Yes, that's interesting.
lower income people. And so we let the market determine the price and the selection because by letting the average person decide
Yeah,
what is worth having in a supermarket and not. And
yeah,
lower income people get the benefit of the market to get the biggest bang for their buck on the food stamps that they receive from government to help
sure,
them pay for their
sure.
food.
It brings apart another question of when people throw around words like, it was funny all of a sudden when Obamacare came out, like now we're a socialist country. Okay, this is socialism. It's there's a lot of things that are socialized. Healthcare is a big one, but I don't know if that necessarily means you're becoming a socialist country. I think people like to say that word a lot, but it does beg the question a little bit on like what it means to be free market. And in a pure free market, uh, you wouldn't have any regulation, I suppose, right? The purpose of government is to add regulation where there can be exploitation, ultimately, right? Or you can create some utilitarian benefit by adding regulation, but it gets out of control. So it's. I try to think about like it's almost every. I try to think of an industry that is really purely free market. And I don't know if I can think of one. And it gets me always back to the idea: what is the amount we're willing to accept, right? Of in each industry.
Well, it's what is the best way to find the best value, not what price are we willing to accept, but what is the solution to getting the best value? And so you point out correctly so that the government regulates at some level most industries. So, as we talked about, the grocery store industry, the Food and Drug Administration regulates certainly food. Our food supply, there's a certain level
Of
of
course.
regulation to make sure the food that is sold to us through supermarkets is of at least a minimum quality, which is generally a pretty high quality. And grocery stores that sell fresh produce, if they don't sell it by the sell by date, they have to throw it away. And
Yeah.
so there is regulation in supermarkets that is, I call it a pretty light touch regulation, but there isn't regulation in who sets the price, and that is
Mm-hmm.
key.
Yeah.
And then when a person goes to the grocery store, when they the government doesn't tell them what to buy. And
Yeah.
so the a person who goes to the grocery store can buy what they want as long as they're willing to pay for it. They know what the price is before they pay for it, and then when they check out to move that money from the individual's account to the customer's account to the grocery store account, if they use a debit card, it's about 1%.
Hmm.
So for me, that system gives you the best bang for your buck for food.
Yeah.
I would
So
like to
that's an
take
acceptable level of regulation. Food is an acceptable level of regulation. It protects us. You can charge whatever you want for for a jar of
right,
sun dried tomatoes. You charge
right.
$1,000. You probably won't sell them. But it reminds me of the taxi industry before there was like Uber and Lyft or whatever, or now Waymo and robo taxis coming soon. But and I'm sure some of them still work like that. I don't know for sure. I haven't followed it in the last 10 years, but there was a time where you could not the metered rate was like the most regulated thing in that industry.
Yes, exactly.
You couldn't offer incentives. There was never like buy one cab get one free. There was like rules around this type of stuff, from the metered rate to what you can offer and how they can track. It was really wild, and I learned of that through my first business. Actually, uh, I had it was interesting that it was part of what we were working on, and I had to learn a little bit around that. It was
In New
uncomfortable.
in New York City, in
Yeah.
order to operate a taxi cab, you had to have what was called a medallion.
Yeah.
that was fixed. It was bolted onto your taxi cab. You had to
It's an
have that
actual
medallion,
medallion.
an actual medallion. Those medallions at one point had a market value of $1 million.
It was an old market around a regulated item. It's
Well, it wasn't the price of the medallion was unregulated, but the value of the medallion was so great because the taxi cab industry had gotten the regulators to let them charge a lot of money.
yeah.
So they
But
could
also to
charge
get the
so much.
medallion wasn't easy, right? There was you couldn't
No,
just get a
that,
medallion. Yeah.
that cost a lot of money to get
Yeah.
them, or you usually bought them from somebody else. There was a limited number because the New York regulators wanted to keep a minimum number of a certain number of taxis on the street so that every taxi cab operator could make a lot of money.
Yeah.
And the taxi cab operators in turn contributed money to the politicians that set the regulations so that they could charge a lot of money.
And the wheel goes around and round.
Exactly. Exactly. And Uber broke that model. Uber
Yeah.
broke that model.
I can't wait for the next one. Autonomous cars is where I get really excited about. I think it's
Yes.
I went the first time I took a Waymo, which I don't know if they have in Nashville yet. I don't know if they have any
I've not
automated.
had that opportunity.
No, it'll come soon. I forget. There's a couple, Austin, San Francisco. I forget where there's a couple of these for us doing this, but like in Waymo in West Los Angeles, and it was maybe a year ago or 2 years, whatever it was. I jumped into this with a buddy, and it was like I feel like it was a rite of passage a little bit. It was like it's like one of those experiences you'll never forget because your whole life you're used to driving a car. You can't imagine a car not having a driver. It's almost right. And then you
It-
do it and you're like, no way. Like, and my mind was blown the first time I did it. It felt, top memorable experience. And it was funny because he wanted to do it with me. It was like he kind of knew that I was going to have that impression. And he's like, I want to be the guy riding with you in that
yeah.
Waymo.
It's
Yeah.
interesting what innovation does. When I was going to college, my mother bought me as a gift for going away to college. She bought me what was called at that time, it was a handheld calculator made by Bomar. It was about that thick. It was about that big, and it could add, subtract, multiply, and divide. That's what it could do. And it cost $125. And this is back in 1968. Okay. It cost $125. Within about 5 or 6 years, you had wafer thin calculators that could add, subtract, multiply, and divide, that they put them in cereal boxes. And so they were free with the cereal. And that's what innovation does. Innovation and patents will always drive the price of a product down, or it will keep the price close to the same and drive the value up. And that's what markets do, and that's what competition does. Our healthcare industry doesn't operate by those principles, and therefore it is very, very inefficient. And it's
Yeah.
it's what's bankrupting the country. It is what
So
it
bring
is
this
what
back to the government shutdown.
the government shutdown is over this issue of, do we increase the amount of money that we spend on healthcare? Because fundamentally, you had Obamacare that passed, and then when COVID hit, and when Biden became president, he signed an executive order that under an emergency, he declared an emergency and extended the subsidies for Obamacare so that it would include families up to $500,000 in income in some areas of the country. And so now the Democrats are saying, well, we want those subsidies that were supposed to be emergency in nature, and only because of COVID, we want them to be made permanent. And in addition to that, we also want people who are in this country illegally to have a right to Obamacare. Well, how can somebody who is here illegally, having committed a crime to get here, have a right to something as expensive as health care? Because as I said, we're spending $15,000 on average a person. So if you have a family of
Yeah.
4 that illegally sneaks across the border, according to the Democrats, we should spend $60,000 a year on just their health care. And I don't think that's sustainable.
Well, let me ask
It,
you
it
this: is it the, is it the right thing to do to give people health care, or is it for uh, to get their future vote, uh, or
well,
or the people that they know's vote, or whoever, right? Or is it both, or something else?
now, Evan, you have gone off into an area of political philosophy that I absolutely love talking about, and that is the importance of constraints. I just love this conversation, brother. I'm having a great time. But I live in where do you live? Where do you live?
Now I live in Los Angeles.
Okay.
Yeah.
All right. Then I live in Tennessee. Tennessee has
Hmm.
no state income tax.
Hmm.
And we are required in our Constitution. We have no state income tax because of our Constitution. And our Constitution requires that the state balance the budget. In the 60s, 70s, and 80s, our state was run by the Democrat Party. They had a lock on the legislative branch and the executive branch, but they could not spend money beyond what they collected in revenue, and they couldn't impose an income tax, or at least they didn't believe they could. So consequently, they would about every 3 or 4 years they would raise the sales tax by 0.5%, and that gave them enough money to spend it on things that they wanted to spend it on. But the point is, they were
They didn't get bond
constrained.
money from the. They didn't get bond money from the big banks.
No, no, we are a very we're actually the lowest indebted state in the country per
Wow.
capita.
Yeah. California's
Because
very good at that. We that's why there's such an issue here, because we have Bank of America and all these big banks giving us these big bond monies for all these things. That's why you can't break the cycle.
Yeah, exactly. But in Tennessee, because of the constraint, because of the constraints, the party in power was limited into what it could do. And so they were forced to sit in a room, even though every single person in that room wanted to spend more money than they were collecting in revenue. They were prohibited from doing so. And so even though the
Hmm.
Republicans had no power at all, Democrats acted quite responsibly because they had no choice. Now, by the way, I'm not blaming Democrats per se, other than just explaining the history here, because human nature is such that if you give people in power a way to buy votes by going into debt to give money to people, give things to people for free, many politicians will choose to do that. But if you
Yeah.
eliminate the opportunity to borrow, then if politicians want to give money to some people, they have to take it from somebody else. And that creates a rub. And this is the one thing that Milton Friedman got wrong when he said that as an interest group got bigger and bigger, there would be natural constraints that pushed against them so that the amount of damage they could do would be limited. He died before he saw the explosion in federal debt. And so
Mhm.
it's because of the ability to borrow money that politicians are able to give money to people and to essentially, as you say, buy their votes. Is it wrong, morally wrong? I think it's morally wrong, but
Yeah.
it's the way our system works. And so we have to work within the system
Yeah.
and try to come up with solutions within the system. I believe
Yeah.
healthcare
It's it.
reform can be addressed, but please go ahead.
No, you know, you're saying a lot of very interesting things. And it gets a lot of times for me when it comes to, and I know you're a lover of political philosophy, all the great thinkers um, who have tried to get how we ought to exist right. You
Right.
know,
How should we be
starting with Plato.
How should exactly? And we, by the way, in the Giants of Philosophy, which is not, we've done that also, but we haven't put that up. Right now, all we have
Yeah,
available is the Giants of Political Thought. But we did Plato, we did Socrates, we've done Aristotle, and so
yeah,
sometime if you're interested, I'd love to come back on your podcast and talk about some of these ideas in their context of when they started, which was
sure.
thousands of years ago.
Well, a lot of times I think about these folks and I say, look, if these very bright minds who have thought through this thoroughly haven't got it right yet, they've tried, they've made great contributions, right? But
Mhm.
no one's nailed it. No one. Even the current system, it's not figured out yet, right? It's
Well,
the
our
best
con
quality of life for the most number of people that it's ever been,
yes.
because that's we've improved, right? But
Yeah,
it's far from perfect. And I think there's a level of humility that if we can accept as a society that we're still improving and we still are the best it's ever been. Like, I don't know when people thought it was better. Like but in terms of quality of life, living in Nashville or Los Angeles or any major
sure.
city, when it comes to access to basic stuff, it's like we don't really have those issues here, for most people, and a lot of countries still do. But even around the world, it's the best it's ever been for 7 billion people. Like in terms of disease, in terms of starvation levels, in terms of education levels and rights and the freedoms that people have. So a lot of times, and it's why I like to think of, well, what is the balance between these things that we know are wrong, right? We know I've had my own healthcare uh, situations where it's just like, even with a blood test, where it's like, you said I get a free blood test. Why do I have to call and negotiate? You charged me for the blood test. You said it was free. Now you're telling me I got the code wrong? Don't make me get into a code conversation. It's the simplest possible thing for you to do for me. And you're telling me I owe you money?
Well,
Like
but
for
if you could have paid for that at the time of service with a credit or debit card, then all of the other things that you're talking about that regarding that blood test would have not happened. If there is a
Sure.
website, by the
Yeah.
way, there is a website called medical doctor
Yeah.
mdsave.com mdsave.com. Go to that and type in colonoscopy or
Okay.
knee replacement, and then put in
Right.
your zip code. And there
Yeah.
will be doctors who are in your zip code who will perform that service for that price.
That's a great
And
reference too.
you pay MD Save, and they keep 10%, and they give
Hmm.
90% to the provider.
Great.
And you'll if you want to get an MRI, it'll be a few $100s, not a few $1,000s.
Right. Yeah. I
And
had
so,
even with cholesterol stuff, they wanted to put me on statins when I was 20. So I have high
uh,
family whatever, right? And I ignored it. I'm healthy. I'm as fit as I've ever been. I'm 42 now. I couldn't I mean the best hell, I have no other risk factors other than this number. And they're learning now there's a lot that we thought not that goes against what we thought statins were doing and some of the effects of it 20 years later. And they're learning that cholesterol is not just the number. There's all types. There's not just there's different types of LDL and different types of HDL. So by the time, I guess, when you hit 40, now they give you the cardio IQ, which
oh,
breaks it into the things that are more relevant, right? Your ApoB, which came out, was like a big thing, and like all these other levels to see if there's really are risk factors. They also give you the iodine CAT scan, calcium test, right? And which is really the biggest thing, that if you have blockages in your arteries,
oh yes,
then that's a risk factor. But if
yeah,
you
yes it
don't,
is.
some people just have high cholesterol, and they're so this is an interesting thing. Cholesterol is not really understood. I've asked heart surgeons now, we're always recommending statins and all, and they're like, you know what, I don't know anymore. It's complicated. Cholesterol is very important for the body, and it's not quite as easy as they thought. So I haven't taken it, the statins, and I was disappointed that I was learning all of this at 40, and what they wanted to do was give me statins at 20. And it's probably to prevent their risk in life. They're told to do it, and they have liability if they don't. But that system is part of this. Like, you wanted me to go on drugs my whole life, and now I'm told by doctors you're just fine. You're only one risk, silly number, and you have no other risk factors at all.
Well,
You know,
if you like to study that issue more deeply, one of the companies I'm invested in, we've been selling a very product that is extraction from green tea that has a super enriched uh, a blend of theaflavin. And the name of the website is soltea.com, SOLTEA.com. And if you click our science button, you'll see a white paper that was printed 25 years ago, approximately,
Awesome.
in the Archives of Internal Medicine. And I've been taking I'm not trying to pitch the product per se, but I'm following up on your
That's okay.
conversation. I've been taking that
I
product.
love health stuff. Mhm.
I've been taking that product for about 25 years, and I'm 77. I take zero prescription drugs. Now, you find me some other people who are 77 who take zero prescription
Wow.
drugs.
Good for
I
you.
have a fantastic cardiovascular system.
Wow.
No,
Good
no,
for you. I
not
love
much
hearing that.
hair, not much hair, but a great cardiovascular system.
Hey, I can relate. I understand. The hair thing, I understand. I was
Yeah,
19 when I had to start saying goodbye. I watched it fall out on my college desk. I was like, what is going on? By the time I was 21, 22, it was, but
yep.
hey, I don't
There
think
was
I
a
would grow it back.
there was a comedian called Gallagher, and one of the comments he made, 'cause he was a young comedian, didn't have any hair, and he
The
said that
watermelon guy, smashing watermelons, right?
the watermelon guy, exactly. He would say that I woke up in the morning and looked down and he saw a hair on his pillow, and he said, "I wondered what held it in yesterday." I thought that was but he was a good comedian, and he was the watermelon guy. You're exactly right.
I remember that. He's a character, and he was bald, but he had the sides and the back or something, right?
Yes.
Something like that.
Yeah.
Yeah. Um, well, so this has been a great conversation. I hope our audience learned a lot. I surely learned a number of great things. And look, I think it's so important that people can understand nuance and see that a lot of these things just require, if you don't take too staunch of a belief on what you hear on the news every day and start using a little critically thinking, you can have real intellectual conversations and come to solutions.
Yeah.
And you can go back and forth and debate solutions, but that's where we need to be getting into intellectual debate around solutions, especially around issues like health. I mean, all the big issues, but things like that. If there was a perfect right answer, I always say, things wouldn't be so divided. Usually that means there's nuance and we need to narrow, massage through the nuance. Um, but yeah, anything else you want to leave today
No, I really
before we
appreciate it.
go?
As I mentioned to you earlier, we have a From Our Generation is the name of our podcast, and we're up where most podcasts can be found. But we
Yes.
also have a website called giantsofpoliticalthought.com. And years ago, I started a company that produced and marketed, back in those days, it was audio cassettes on history's most influential thinkers. And that is now morphed into a streaming service that we have. And so if somebody goes to giantsofpoliticalthought.com and wants to have audio programs on some of the most important political thinkers in the last 300 to 400 years, and we cover all of them. We consider somebody who's a giant of political thought not necessarily a good thinker, but an influential thinker. And so we cover Karl Marx and the Communist Manifesto. I don't agree with him, but we do cover him. We cover
Right.
Rousseau in the Social Contract. I don't agree with him. John Locke, Two Treatises of Government. I do agree with him. Adam Smith, Wealth of Nations. I think it's very worthwhile. But we also cover Thoreau, Mary Wollstonecraft, the Declaration of Independence, Common Sense, the Federalist Papers. So, and once you have it on your phone and you can share it with four other devices, which could be four other family members, it's a tremendous bargain. And then we also have the transcripts are available and questions on each of the programs. The questions are divided into three categories: questions of fact, which is kind of important trivia; questions of understanding, what did Jefferson mean when he wrote such and such, and then essay questions. For example, one essay question would be, if the Declaration of Independence had never been written, would the Constitution have been written the way that it was? Well,
Hmm,
there's no exact answer to that, but it creates a discussion because
sure,
our Constitution is a document that is, I would describe it as unique in political history as
sure.
to how it's written and why it's written the way that it is. And that's a topic for another day, but a very
Yeah,
interesting topic indeed.
for sure. Well, I hats off to you for pursuing more political philosophy and less politics. And I think that is the answer to a lot of problems. Is if
Yeah, I appreciate it. I
embrace
appreciate
the
your time today.
yes,
Thank
sir.
you very
Yes,
much
sir.
for having me on your podcast.
My pleasure. This was wonderful. Have a great day.
Thank you.
All right.